Are you dealing with a painful canker sore? Don't worry, you're not alone. Canker sores are a common type of mouth ulcer that can form inside the lips, cheeks, and other parts of the mouth. They're usually shallow, white or yellow lesions with a bright pink or red border, and they can range in size from 1 to 4 millimeters. Canker sores are not contagious, and they're not caused by the herpes virus like cold sores. Instead, they can be triggered by things like low levels of vitamin B12 or iron, autoimmune conditions, and high-acid foods. But how can you tell if your canker sore is infected? It's important to note that canker sores are usually not infected, even though they can be very painful. However, if your canker sore is unusually large or has been further injured, it may be at a higher risk of infection. If you think your canker sore may be infected, you should consult with a healthcare professional. They can recommend an antiseptic wash for minor infections or prescribe an antibiotic if necessary. Now, let's talk about some other things that can cause oral infections. If you have symptoms of an oral infection, it could also be caused by things like an infection after wisdom tooth extraction, an abscess, or oral cancer. If you're experiencing pain, swelling, or difficulty swallowing, it's important to see a healthcare professional as soon as possible to determine the cause and get the appropriate treatment. So if you're dealing with a canker sore, don't panic. While they can be painful, they're usually not infected. If you're concerned about an infection or have other symptoms of an oral infection, be sure to see a healthcare professional for proper diagnosis and treatment.